Hi, my name is Shakaya, and I am the nurse that's going to be performing a catheterization on my female patient, Mary Smith. I'm going to be reading a little bit slow and going a little bit slow just so you'd be able to keep up with me and everything is in order. The first thing I'm going to do, obviously, is assess the physician's orders. My patient, she is due for her 10 a.m. antibiotics, and she's complaining that she feels like she needs to urinate, but she hasn't voided since 5:30 this morning. So I will review the client's chart, and I find that if she hasn't voided within 4 hours, that I'm to bladder scan her. And I realized that after I bladder scan her, I have 400 mLs of urine in her bladder. So she definitely needs to be bladder scanned. So now, since I have read her orders, I will ask Miss Mary, excuse me, if she has any allergies, specifically to latex or iodine, and she has expressed to me that she does not. I have already looked at my insertion tray. It is not expired. So I will now close the door, close the curtains, and perform hand hygiene. I have also done 2 identifiers. So I used her name and her date of birth. And Miss Mary is alert and oriented, so she was able to positively identify who she was and her birthday. The lighting that I have for this situation, this is actually as bright as I could get it in my living room. But obviously, if I was in a hospital setting or a different type of setting, I would turn on all the lighting that I needed and all the lighting that was necessary to make sure my lighting is good. Miss Mary has also informed me that I do not need to call in one of the LPNs or the CNAs to help me, because if I do need any assistance, she is more than willing to reposition herself or do anything that she has to do to help me in achieving getting her catheterized. So now that I have donned clean gloves, I will ask Miss Mary to please, and I will also assist her into getting into the dorsal recumbent position with her knees flexed. They'll be about 2 feet apart, and her legs will be abducted. I will now drape Miss Mary, and then I will have her position herself in a way so I can now slide a waterproof drape underneath the patient. So we can just pretend that that towel that's there is the waterproof drape that's underneath her. Now, before I start the actual catheterization procedure, I will do hand hygiene again. Put on some clean gloves, and I'll clean her parenteral area with, whatever I have present, whether it's my washcloth, my skin cleanser, something to definitely clean her. And I will wipe from the above orifice downward toward the sacrum from front to back, rinse dry, remove gloves, and then I will be performing my hand hygiene again. So now I will be going over to my kit that I hope is my right kit. The reason I say that is because looking at the directions and then looking at the contents of my kit, I don't see a Foley that's, like a Foley cath that has a balloon at the end. The kit that I received, it looks like a straight cath kit, which is fine because I could still use it and, do what I have to do. I have to do whatever I can to empty this patient's bladder. So I will do that. And also, I'd like to note that my sharps container, which is my disposable container, is in an area that I could reach it. My sterile gloves are there. My clean gloves are there. Everything is in reach. I have a trash can also close by if I need it. So my setup is pretty much where I need it to be. Obviously, when I am in a hospital setting, I would obviously have everything on most likely a tray table or something next to me. That would be a little bit more convenient. Now, the next step that I would do is, this is where I would be opening the sterilization tray. Once I do open the tray using the sterile technique, I will then don my sterile gloves, and then I will ask the patient to lift her buttocks so I can slide the sterile drape underneath her with gloves protected by the cuff. So I would then go in my kit and I would place a drape, a sterile drape over her parental area where it's just exposing the labia. So I don't need all of her to be exposed. I can just have, what I need exposed, which is obviously that hole that's over there. So now I'm just backing things up a little bit, especially since I actually have a pair of sterile gloves in here that came with it. Obviously, my hands are washed. I do know how to open up sterile gloves. Again, the kit was, I personally don't think that this is the right kit, but I'm going to work with it the best I can. I am going to don sterile gloves, obviously not touching, any other sterile part. I could see which way it begins. Okay. Oh, that's backwards. Hold on. I still didn't break the sterility barrier. Okay. And then I'm going to put that down. Okay. So that's trash. And don't need those gloves yet. Here would be the drape that I would use. This looks like, well, I can tell that it's the drape that would go underneath the patient. So next, we have the lube in here. And all I have is these 3 swabs, but I remember in the directions it said to use 3 cotton swabs. So this is going to be my pretend iodine, betadine. And what I would do here is I would identify her meatus, obviously, and then you do 1 swab from the top down. That's 1, garbage. 1 swab on the other side, down. 2, trash. 1 swab going straight down. 3, trash. Now, in the meantime, now that my patient is all clean and she's ready to go, obviously I would not leave all this stuff here, but you get you're a very smart lady, so I'm sure you understand that this is sterile because of the situation that I was in. If it was at home, it's kind of hard and unnecessary for it to be sterile, but here obviously this is all clean. I'm just having this here to have it there. So in the meantime, if this was, say I was inserting a Foley, but again, I could still straight cath with this. I would dip this in some lubricant. I would dip 1 to 2 inches of the catheter tip in some lubricant. And then after that's done, with my non-dominant hand, I take the meatus open, and on the first shot, I get it in there. Now, something else I would do is I would put this here as a protection just until I went and got my specimen cup or, whatever the situation may be. But since based on the assignment, I'm just emptying the bladder, I could put that in a bag or I could measure it afterwards. But we're just trying to, get her bladder empty. So that is how I would put it. That is where it goes. Once I have it in there, I don't need to hold it. I just need to give the patient a second to empty her bladder naturally. Now, I know that it could be a little bit later in the video. I've been recording, so I honestly can't remember if I did say it because I've recorded this so many times. But again, if I did have a kit, I know the proper way to open this. You are supposed to open the kit away from yourself. You are supposed to make sure that you try to keep this entire area clean at and sterile at all times. So I know things are to be opened away from me. I know that these gloves, once I have them on, I touch anything else, I've broken sterility. So I'm very well aware of that. I'm just letting it be known because it's a little funny recording yourself, but I feel pretty good. So I'm just letting you know I do know how to properly do the sterile technique. So now that Miss Mary, say this is still here, now that she is done peeing, I will, now that she's finished and her bladder is done emptying, I will now remove this because there's no need for me to keep it in her any longer. Ooh, hopefully that doesn't fall. And I will put this in a spot where I will be able to measure everything that happened afterwards. And I will then put this in my sharps container. Let me see if I can open it. Well, yeah, without tipping it over, but you get the gist. Obviously, I would, make sure that tap is up there good. And then I would just wipe her perineal area to remove any excess betadine, or, for all we know, she could have gotten a little bit of lubricant on her. And I just want her to be comfortable. Still providing privacy to her. Still letting her know that she's okay. Afterwards, I will get her all set and in order and back to how she was, making sure that she's comfortable. I can now remove these gloves and they can be discarded into the trash can that is nearby me because I no longer need them. They are dirty. I will then perform my hand hygiene. Now that we got 800 magical cc's out of her bladder, I will definitely let the provider know. And now it is time for me to document my procedure, document everything that happened. I will document how the patient handled it. I will document every tools that were needed and any pertinent information. I will also document the output, and Miss Mary's bladder is now empty.